Good morning, everybody, and thank you so much for your response to my video yesterday. I posted a video yesterday just urging South Africans to take this coronavirus infection, or this coronavirus pandemic, more seriously. And that was just based on the fact that, you know, if you look around in most areas, you wouldn't even realize that we are in a pandemic, and it just felt like because of, and I think there are a lot of confounding factors here. I think that because of things like fake news and because of hearing conflicting stories, some people just didn't feel like it was something that we need to be taking seriously. So some of you responded quite well. Others of you said, you know, it's too late. You know, we've kind of missed the boat. And to that I say, it's never too late. Guys, at this stage, we need to be positive and we need to be standing together. And if we are going to take the approach that, you know, it's too late for that now, etc., I think that it creates, weaknesses in us standing together, and we don't need that at this time. We need to stand together. We need to be all fighting for the same thing, which is to stop the spread of this infection, especially because we know that it's going to affect those who are already vulnerable the most. So I just want to say the video yesterday is not about negativity. It's not about fear-mongering. It's not about creating a sense of panic. Rather, it's about warning and just reminding us that this is not the time to be working against each other. It's the time to be working together, and the only way that we beat this is if we all as individuals do our bit. But I thought that I'd just speak today a little bit about the healthcare system and how this pandemic is going to highlight the inequalities within our healthcare system. We live in an unequal society in South Africa. We have, the very rich and the extremely poor in this country, like many countries, I suppose, around the world. But when it comes to our healthcare system, we see that, that inequality reflected in the public and the private healthcare system. And so I started recently working at the clinics, and I just want to be clear that I didn't start working in the clinics because of the COVID-19 pandemic. I started working in the clinics because of NHI. So for those of you who may have heard, NHI, or the National Health Insurance, is currently being established in South Africa, and there's again a lot of controversy around the NHI. And without getting too much into what NHI is and how we plan to execute it in this country, I think that the foundational principle of NHI is universal health care. So what does that mean? Universal health care means that health care should be accessible to all, regardless of whether you can afford it or not. It also says that health care or seeking health care should be something that is not going to bankrupt you financially. And thirdly, it means that the healthcare that you're able to access is of an optimum quality. Okay, so 3 things with universal healthcare that you need to keep in mind. So what NHI is hoping to do is to kind of level the playing field between the public and the private healthcare system, because there are huge inequalities in healthcare in this country. And so a lot of people are against NHI. It's a very polarizing issue. But I think the one thing that people who are against NHI overlook is because a lot of people say that, yeah, but the public healthcare system is broken. We should fix the public healthcare system first before we start implementing NHI. But what people are not realizing is that the private healthcare system is broken as well. Okay, there are huge issues in the private healthcare system that many people simply overlook. Like, for example, the fact that healthcare in South Africa is probably one of the most expensive in the private sector in the world. And so, and and there are many other issues that maybe we can discuss at another time. But what the COVID-19 pandemic is definitely going to do is it's going to highlight those discrepancies between the public and the private healthcare systems. And so definitely at this time, something that we may see is the nationalization of healthcare, of private healthcare in this country. And I know that is obviously something that is going to ruffle a lot of feathers, but what we need to remember is that in times of crisis, drastic times call for drastic measures. And so it is very important for us to remember that. And I don't know if this is going to happen or not. It's just something that I've been thinking about. And so this is purely my opinion and not based on anything that anybody in government has committed to at this stage. But I think that we are going to see a shift in healthcare through the course of this pandemic, and certainly when we come out of it on the other side. And notice I said when. It's not an if, it's a when. We do have a long road ahead of us. We do have a lot of things that we are about to face. If you look at what's happening in other countries, we are definitely in for a tough time ahead. That's not to say that we should be hopeless. That's not to say that we should be fearful. It's also not to say that we should be negative at this time, but it is to say that this is the reality. With 651 people dead in Italy yesterday as a result of COVID-19, it's a crisis, okay? And so I'm not saying these things to create or instill fear. I'm giving you perspective, because I think that for a lot of us, we don't know where to look for credible information, and for information that's going to be adding value and being helpful as opposed to creating fear. And some people are out there just planting fear. That's not what this is about. But I do think that when we come out of this on the other side, the need for universal health care is going to be urgent, and I think that this pandemic is going to push us into a stage where it's no longer like a concept that's kind of hanging in the air somewhere. It's going to need to be something that is addressed promptly, and it's also going to need unity. I think that, of course, as I said, NHI is a polarizing issue, but in a time of crisis, in a time of pandemic, in a time of emergency, it's important that we stand and we stick together. And so, in the same way, after the pandemic, when it comes to, okay, this happened, we were not prepared, just like the rest of the world. How do we better prepare ourselves for the future? Universal health care is definitely going to be a matter that urgently needs to be discussed and accepted and adopted by this country in order to create a better sense of readiness for the future. So I just want you to think on that for today, and I wish you a beautiful day ahead. Please take care of yourselves and stay safe. Bye.